Go ahead.
Chris Coombs here, talking a little bit of truth in diabetes. I'm here with a longtime doctor of mine. This is Dr. Dyget at the Ogden Vision Center. He's been my eye doctor for about as long as I've had diabetes. Now, Dr. Dyget, why is it very, very important for someone with diabetes to visit an eye care professional on a regular basis?
Patients with diabetes have typically the opportunity to prevent problems if they are seen on a regular basis, not only with their primary care physician, but their eye care provider as well. An annual dilated examination of the inside part of the eye can give us clues as to how well the patient is doing with their sugar control. Typically, if we're able to catch those things early, we can prevent some very tragic things that can occur with their eyes. And so, in general, its prevention is worth much more than trying to catch up after a problem is found.
So when you're doing an annual exam or a dilated exam, as you called it, what are the things you're looking for specifically in the diabetic's eye?
Well, part of it is we're checking to see if a prescription has changed, because oftentimes if the sugar is out of balance, we're going to see a strange type of shift in the prescription. But the biggest thing that we're looking for is the eye health, which we're looking into the back part of the eye, back to the retina, and looking at how the vasculature is doing. And if there is enough oxygen and nutrition getting to the retina. If there is, typically the retina looks fantastic. If not, we're going to see some signs that there are areas of the retina that might be suffering and that might need some attention or better sugar control.
What in your opinion, what is the most important thing someone with diabetes can do to take care of their eyes?
Don't take it for granted that you're not going to have problems just because you don't today. Just trust that the experts that you're putting your confidence in to look at your eyes are going to lead you in the right direction to make the right decision. An eye care provider can give you advice and if nothing else, the peace of mind that you're doing everything that you need to do to keep your eyes healthy and keep your overall all health healthy. And that would be my biggest bit of advice, is just trust who you're going to trust and let them help you.
How often does somebody with diabetes need to get in to have an eye exam?
That would be annually, or more often if you're having some symptoms that might warrant getting attention earlier.
Okay, any other tips, suggestions, or knowledge you could share with somebody as far as the overall health of their eyes and how it relates to diabetes?
Yeah, just make sure that you're following the advice of your primary care physician or your endocrinologist that will almost always advise you to get your eyes checked from an eye care provider once a year. And if you do that, you're gonna have the most opportunity to make sure that your eyes stay healthy.
Hey, great. Thank you.
You bet.